Hello, good people. How are you? Yes, once again. Yes, medicine is very beautiful if you understand the things you're speaking about. And I'm Sudi Shaban, and today we are continuing with our series of medical complaint series. And today we are going to look on the another medical complaint, which is a headache. So the patient come to you complaining of, "Oh, doctor, my headache is hurting so much. So how can I help you?" So let me take you through it. So headache, you have to know headache is very broad chief complaint, and the only individual who can tell you the direct diagnosis after mentioning the headache maybe is a witch doctor. But as a real medical doctor, what you are supposed to do is to make sure you amplify the headache so that maybe not directly to have a correct diagnosis, but to have a most likely diagnosis. Diagnosis which, upon giving maybe or doing some investigations, you're going to have a working diagnosis at the end of the time. So the patient, assume the patient present to you with a headache, and you have to know that when the patient presents with a headache, the way they describe it usually hints at the likely diagnosis. And for example, if the pain is throbbing, the patient describes the pain to be throbbing in nature, and in terms of severity, the patient reports the pain to be moderate to severe. Location maybe is most on one side, so it's unilateral, and maybe worsened by light or noise. So the patient of features are suggestive of phonophobia or photophobia, and accompanied by nausea and vomiting. Plus or minus the history of similar episodes in the family, and this is the point that you have to think more for a migraine headache. So migraine headache are those features: throbbing nature, moderate to severe in terms of severity, patient present with phonophobia and photophobia, family history of similar presentations,